Good afternoon, everyone. This is Soro Arakinias, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medication news and updates. So, in this video, I want to answer a few questions about heart failure medications. There were a few requests about explaining in summary about heart failure medications available in the market, and I want to list them over here for you to see and to get familiarized with heart failure medications. So, heart failure medications are a crucial part of the treatment for these patients affected by heart failure. Basically, it's your heart failing to pump the blood through the body. These medications address both the symptoms relief and improving the survival, both of which are important. Medications used to manage heart failure include diuretics, vasodilators, digoxin, ACE inhibitors, beta blocker, aldosterone antagonists, ARBs, ARNIs, SGLT2 inhibitors, and ivermectin. And I'll get into each one of these separately. But before that, I want to mention that heart failure it comes in various stages of the disease, from stage 1 to 4, as the patients get worse. A lot of these patients have symptoms of dyspnea when walking, chest pain sometimes, and lowered ejection fractions. So to prevent the heart failure to get worse, these patients may take or may be prescribed one or combination of these medications that I'm about to list. So the first class is diuretics or water pills, as some patients know about, and that help the body to get rid of the excess fluid, reducing the swelling and shortness of the breath. Vasodilators, which relaxes the blood vessels, making it easier for the heart to pump blood. Digoxin, which strengthens the heart contractions and slows the heart rate, particularly helpful for some heart rhythm issues. ACE inhibitors, which relaxes the blood vessels and block the effects of the certain hormones that worsens the heart failure. Beta blockers, which slow the heart rate, lowers the blood pressure, and protects the heart from effects of stress hormones. Aldosterone antagonists, which block the effects of the aldosterone, obviously, a hormone that can worsen the heart failure. ARBs, similar to ACE inhibitors, this class of medications relax blood vessels and block certain hormones. ARNIs, or angiotensin receptor neprilysin inhibitors, they combine in an ARB with a neprilysin inhibitor, which helps the body to get rid of excess fluid and sodium. SGLT2 inhibitors, which in recent years especially have proven very effective, not only just for diabetes patients, but also heart failure patients. Originally used for diabetes, they also provide a benefit for heart failure by reducing the risk of heart-related death and hospitalization. Ivermectin, as I mentioned, slows the heart rate by blocking a specific channel in the heart, so it helps with the heart failure symptoms. Hydralazine and isosorbide dinitrate, a combination that helps relax the blood vessels. Soluble guanylate cyclase, or SGC, stimulators, such as Vericiguat, a newer medication that can help improve heart failure symptoms and reduce hospitalizations. Then we have the antiplatelet agents such as aspirin or clopidogrel or Plavix, as you know, and that help prevent the blood clots. And anticoagulants such as warfarin, which helps prevent the blood clots in the blood vessels, especially for those with higher risk of getting blood clots. So again, this is a list of general list of classes of medications that can be used for heart failure. As I mentioned, some patients, depending on the stage of the disease, they're diagnosed based on the injection fraction, and the provider or the cardiologist may prescribe one or a combination of these medications for patients to benefit from various classes based on various results and that the patient's approaches the patients may receive from multiple different angles and multiple different medications. Again, diuretics, vasodilators, which relax the blood vessels, the digoxin, which strengthens the heart's contractions, ACE inhibitors, ARBs, ARNIs, which is angiotensin receptor neprilysin inhibitor, beta blockers, obviously, aldosterone antagonist, which block the aldosterone hormone, SGLT2 inhibitors, as I mentioned originally for diabetes, but now for the last few years, they have been proven to be very helpful in heart failure patients. Ivabradine, which slows the heart rate for specific individuals, could be beneficial. Hydralazine and isosorbide dinitrate, soluble guanylate cyclase, stimulators, which is a vericiguat, which is a newer medication in the market, antiplatelet agents such as aspirin or clopidogrel or Plavix, and lastly, anticoagulants such as warfarin to be used for some of these patients to help prevent blood clots. Otherwise, that would happen with some of these heart failure patients. So for more detailed information on these drugs, make sure to comment on the video with your questions, and I'll be happy to answer any specific questions you may have, especially on the newer medications such as ivabradine or vericiguat soluble guanylate cyclase stimulators. Hope you enjoyed this video. As always, stay safe and take your medications.